In this video, we're going to be going through cervical spine repeated movements exam. So similar to the lumbar spine or thoracic spine, your way of going about the process is going to be the same. The movements and patient position are just going to be a little bit different. So most times for lumbar spine, patient will respond a little bit better unloaded. Cervical spine, you're usually going to start with them loaded, so in a seated position just like so. Now, the movement that usually will help reduce symptoms is cervical retraction, but this can be done in different movements as well. So just to give an example of that, what you would start with is patient seated. You would establish their baseline symptoms and anything from a functional baseline as far as movements or comparable signs that you'll go back and retest after you perform repeated movements. And then you'll also establish their most distal symptom. So let's say for the patient, they have left-sided neck symptoms that are going maybe a little bit below the shoulder and intensity of those symptoms. What you'll do is you'll ask them to start by going into cervical retraction, just like so, far as they can, and then coming out of it, and then just repeating that same movement, usually up to about 10 times. And what you're looking for is, again, any change in their symptoms that makes them better, that makes them worse, or stays relatively the same. You'll want to assess that during the movement exam and then after, once they're resting. Once they are resting, you'll want to see if they have any centralization of the symptoms. So in this case, if anything was moving more towards the cervical spine from the distal area, if the intensity has changed, and also going back to retesting any movements that were limited within those functional baselines, you'll also want to retest that. If the patient progressed from there and they were able to move past that retraction, the next step you would do is have them retract fully and then extend. So looking up far as they can towards the ceiling. And you would repeat that. You, again, would only want to go there as a forced progression if they were able to go through that retraction and you hit some type of yellow light, so they had no improvement in their symptoms, everything staying the same. And you would go through the same test retest after that.